Good day, everyone. I'm Joanna Luz Santos, and I'm from Mapua University. I'm here to talk about my thesis, which is a computational method or a bioinformatical method to predict multiple epitopes to design a vaccine for pneumonia. Pneumonia is an infection of the lungs that usually affects the alveoli. When a healthy person respires, it expands, but an infected person usually contains fluid or process in it, making it harder for them to breathe. It is typically caused by numerous bacteria and viruses, but the leading cause of bacterial pneumonia is Streptococcus pneumoniae. In 2017 alone, it is responsible for 15% of worldwide death, making it the third deadliest disease. During that time, it killed around 2.56 million children under 5 and immunocompromised patients. Infected person usually manifest fever, chills, cough, shortness of breath, and fatigue. Current treatments and vaccines for pneumonia usually include antibiotics, cough medicine, pain relievers, and fever reducers. But if the person suffers from a more severe pneumonia, they usually require hospitalization because manifestations usually occurs through confusion, diastolic and systolic blood pressure, and over the age of 65, as I've mentioned before, with a low heart rate. We also have vaccines that are available in the market. We have Prevnar 13, which is manufactured by Pfizer and it caters to 13 different serotypes. We have Pneumovax manufactured by Merck Sharp and Dohme Corp, which caters for 23 different serotypes. The problem with the current treatments and vaccines right now is that the bacteria is becoming more resistant to antibiotics. Before, erythromycin used to be a viable option to treat pneumonia, but now it becomes obsolete because they are totally resistant from it. Now, the Prevnar 13, as I've mentioned, caters to 13 different serotypes, and the Pneumovax caters to 23 serotypes. But the problem with that is the Streptococcus pneumoniae has 95 serotype as of the moment, which makes it not effective to a more severe pneumonia, and the efficiency rate of these vaccines falls under 50 to 70%. This study aims to predict cytotoxic T lymphocytes, the CTL, helper T lymphocytes, HDL, and linear B lymphocytes, LBL, from the surface protein of the bacteria Streptococcus pneumoniae through immunoinformatics approach or bioinformatics approach. This approach will also predict the antigenicity, allergenicity, and toxicity of the epitopes for a possible vaccine construct. The significance of this study is to accurately predict both B cells and T cells derived from the Streptococcus pneumoniae that will reduce the cost and experimental time to pave way for more efficient and faster development of the vaccines. Although there are different viruses and bacteria that could cause pneumonia, we are going to focus on Streptococcus pneumoniae since it is the leading cause of pneumonia worldwide, especially to the low and middle class countries that are still struggling in eradicating this disease. So this study is a nine-step process. First, we start off by retrieving the surface protein A, specifically the colon binding protein A of Streptococcus pneumoniae, through UniProt database. And then we proceeded to predicting CTL, HDL, and LDL epitopes using NetCTL version 1.2, IEDB, IBCEL software. So for CTLs, immunogenicity which are negative are no longer a viable option. And then after that, we proceeded with predicting its toxicity, allergenicity, and antigenicity. And then for antigenicity, the threshold value is zero point 0.5. So the softwares we used are ToxinBread, Allertop, and Vaxygen, respectively. All of the CTL and HTL and LBL epitopes are subjected to that process. And then for HTL epitopes, the remaining epitopes are subjected to interferon gamma pred, IL-4 pred, and IL-10 pred to predict its inducibility in those three cytokines. And then the next process is the multiple sequence alignment to test whether the protein will inhibit any genetic mutations. And then the next is population coverage to predict the world exposure of the protein. And then we proceed with the vaccine design itself. What we did is we pick an adjuvant and then we link all those possible epitopes together using a linker. In this study, we use the adjuvant porin B. Okay, and then we are going to move on to the post-vaccine construct, which means we are going to test the antigenicity, allergenicity, and the toxicity, even the simulation of the vaccine construct itself. In order to do that, we tested the antigenicity using Vaxygen 2.0 as well as before, and then Antigen Pro. And then for allergenicity, we use the allertop, toxicity for toxin Fred as well. And then to test the physiochemical properties, we use the ProtParam software. And for immune simulation, we use the CMSIM software. For this, we have the figure that represents the CTL and HTL epitopes. So we have five CTL epitopes. These are the top five, which has the highest antigenicity for the epitopes. This also represents their corresponding MHC binding alleles. So for the alleles, the parameters of that should be equal or less than 2 for their percentile rank. So for HDL, ideally, it should induce interferon gamma, interleukin 4, and interleukin 10. Unfortunately, based on the results, we could not get the an epitope that induces the three of them. So we chose the one that induces interferon gamma and IL-4 or interleukin 4. It is because the vaccine design that induces both of that is more stable and it it triggers more cytokines and chemokines in the site of infection. This figure here is the summary of all the epitopes, CTL, HTL, and LBL. In total, you can see here we have 10 epitopes, 5 CTL, 1 HDL, and 4 LBL epitopes. So, from here, since I already discussed CTL and HDL, here the LBL epitopes, we have 4 with the highest antigenicity. The usual should be just 0.5, but this LBL epitopes has the antigenicity of greater than or equal to 1.4. This table here represents the percent similarities of each of the epitopes from the multiple sequence alignment method. So this method determines whether or not an epitope exhibits a mutation. So based on the results, you can see that two of the epitopes did not show any mutation since it has 100% similarity. The others showed a little to an acceptable range of mutation. However, there are three epitopes that showed below average score for percent similarities. But overall, the conservancy percentage of all the epitopes falls above 65%. Figure 1 shows the graphical representation of the multiple sequence alignment results. Table 4 represents the combined coverage of MHC1 and MHC2 alleles for 16 different areas. So the world coverage is 97.69%. It means that the epitopes and their corresponding alleles has a word exposure of 97.69%. This figure shows the final vaccine construct. The letters in blue are the adjuvants. It is a porin or pore P. It is the outer membrane of the protein Neisseria meningitis. We use this to increase the antigenicity of the vaccine construct itself because it enhances the antigen presenting cell trafficking and cross presentation. In total, we use 10 epitopes for the final vaccine construct: 5 CTL, 1 HTL, and 4 LBL, bound together by EAAK and AAY linkers. This table shows the physical-chemical properties of the vaccine construct. The number of amino acids is 499, which is remarked as suitable. The molecular weight is 53,346.21, which is quite average. The theoretical PI is around 6.72, which means the vaccine construct is quite neutral. Negatively charged residues are at 60, positively charged residues are on 58. Total number of atoms is 7,439. Instability index is 29.73, which means it is stable. Aliphatic index is 75.01, which means it's thermostable. Grand average of hydrophobicity or gravity is negative 0.405, which states that it is hydrophilic. Antigenicity from the software Vaxogen is 0.7099, which means it's antigenic. Antigenicity from antigen pro falls off at 0.944. It's antigenic as well. Allergenicity from allertop is non-allergenic. Toxicity from toxin Fred deems the vaccine construct non-toxic. So to further test the vaccine responses, we utilize the software CM-SIM at 184 and 168 time-step intervals. The figure shows the inducibility of the vaccine construct. The high levels of IL-2 and interferon gamma indicates the inducibility of the vaccine for both cell-mediated and humoral responses, as both aids cytokines in B cell proliferation and Ig isotope switching. In conclusion, the study has successfully predicted and assessed 5 CTL, 1 HDL, and 4 LBL epitopes, which are all valuable information that could pave way in developing a new vaccine for pneumonia that is more effective and time efficient. Since the final vaccine construct has an admirable physical chemical properties and the simulation results also show the capacity of the design to induce both humoral and cell mediated responses, which are all crucial in developing a vaccine. And this concludes my presentation about my thesis, and I hope you all enjoyed and liked this video.